طيب بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله الأمين. Thank you so much, Dr. Atfa, and she can join us anytime to give introduction about the center and also give introduction about this presentation. First of all, is the voice is clear, please? I know my voice, I did have sore throat, sorry for that. Is the voice clear, please?
Yeah, it's so clear.
Thank you so much, Ahmed Osman. And my
Hello.
yes,
It is so clear.
yeah, thank you, thank you.
Okay.
And the screen is also clear, Muhammad.
Yeah, it's clear.
Clear, thank
Yes,
you, thank you.
very, very clear.
All the things that I see is clear. Yeah.
Okay, thank you so much. My name is Hatim Mustafa. I'm basically medical doctor, consultant in community medicine and preventive medicine and public health, working in the strategic management office. I have been working for the last maybe 15 years in the leadership, in the strategic planning, and in also medical education. Very glad to be with you today in a very important topic to me about nursing leadership. And also, maybe you can ask yourself why, as a medical doctor, talking about nursing leadership. And this is also, we will see it definitely when we talk the paradigm shift in healthcare system and healthcare. So also we are all know in health system now, this is a complex adaptive system, an agile system. There is no one can lead, there is no one can provide service in silos. So we have to work together in an inter-professional manner in order to provide the health care to the patient. And also, is my voice clear? Because people are mentioning it is not clear. I don't know why.
So your voice is clear, but there is another voice that's a noise, make a noise.
Yeah, thank you so much. Thank you. We just advise Farah Hamid and all those who open their mic, please mute the mic, please. So let's move
Hello.
to the second slide. I always,
Hello.
hello, yes.
I have no. There is no slide presentation here.
There is no slide presentation.
We just yes.
Let me share it again. Let me share it again, please. Now is it clear?
Okay.
Yeah,
Okay. It is clear. Thank you.
Thank you.
It's clear.
Yeah, okay. So I just go to the previous slide. Okay. And again, when we are talking about nursing leadership, why we are talking about nursing leadership, I already talked about that. Let me start with my favorite learning by Remit. And if we look to this learning by Remit, we would like to emphasize the importance of interactivity and also the importance of learning from each other. And I'm sure all the participants here from a different background, this diversity in the profession, definitely this will create innovation. And this is also will create the leadership in healthcare in general, and also a leadership in nursing in particular. And therefore, I just would like from you all, if somebody have any question, any queries, please stop me at any time because we are learning from each other. No need for this slide, it's just okay. So I would like from you, if possible, to write in the chat, what is your expectation from this presentation, please? Just write in the chat why you are here and what would you like to achieve after this maybe 1 or 1.5 hours. Yes. Just write in the chat, please. What is your expectation? Yes. Nobody is writing something? Anyone? What you expect from this presentation? Yes, please. Yes, to be leader, how to lead, yes. And yes, how to be good leader, excellent. What are the attributes of a good leader? This is, we will know about it, yes. Type of leadership, excellent. Character of a leader, what is the character of leader? What is the, when I say this nurse is a leader, so what do I need to see on the ground? Excellent. As a child nurse, quality leadership, okay. Quality of care leadership, to know new thing about leadership. Okay, excellent. Yes. How to be good leader, what is the attributes of a good leader? Thank you. Okay. Yes. Update about leadership shipping. Thank you so much. Sheila. Head leader. Counselor and leader. Yes. Yes, please. How to assign work fairly between all the staff. Okay, good. This is, although it is a part of management, but definitely management and leadership are interrelated. We will see this later. Yes, please. Okay, so this is your expectation. And what is my expectation? This is my expectation. In any leader, particular a nurse leader, would like to achieve a clear result and a goal. In a football language, if a team plays a fantastic game, but at the end lose, this is not absolutely, it is not achieving the goal. And therefore, as a leader, nursing leader, always begin with end in mind. Always determine your destination and always try to focus on a clear result to achieve. And therefore, one of the characteristics of a leader and a good leader is someone who always inspiring the staff and look for the vision and visionary thinking. And what is the learning outcomes of this presentation? First of all, we would like to see the leadership, this leader who provide high quality service with compassionate care. And this is definitely In order to provide this vision, you need the leadership style and leadership approach. And therefore, specifically, we will try to learn together what are the series and different level of leadership. And again, what is the impact of leadership on patient care, and how to acquire the nursing leadership attributes. Many people thought that leader can born, and this may be to some extent true, but definitely leader is an explicit knowledge we would like to acquire and to learn and to study. And I'm sure most of us who are coming from different backgrounds in a nursing school, medical school, we did not receive enough training in our curricula about the leadership. And after we graduated, of a sudden onset, we found ourselves leading people. We found ourselves leading in a leading position in the organization. And therefore, without having the clear knowledge and the appropriate skills and the attitude for leadership, definitely we cannot achieve our result regardless how you are qualified. And maybe you have a honor in nursing, but this is definitely cannot just give you the leadership skill. And therefore, we will try together to learn how can we acquire these attributes in leadership. And this is just our lecture map. We'll talk about leadership styles and level of leadership. Myers-Briggs MBTI, we'll talk about these tools. And what is the impact of leadership in patient care? And this is definitely, we will try to see it from different studies and evidence. If, for example, I improve my leadership skills, how this impacts the patient using certain indicators. Planning for patient care, this is another area which you need leadership skills. Vision and mission, definitely important for any leader. Emotional intelligence, and what is it and how can I use it to strengthen my leadership capabilities? And how you monitor and evaluate the plan, and how you monitor and evaluate your leadership also capabilities. And also, we will talk about the interprofessional collaboration. Ibrahim, would you like to say something, please? Ibrahim raising hand. Yeah, Ibrahim. Oh, maybe my mistake. Okay. So let us, we aren't creating leader. We are uncovering people's leadership capabilities and providing a path for them to put their capabilities in the practice. So if we look to this quote, we think that this lecture definitely will not add to you many information unless you have the fertilized leadership, and this is can be definitely, we will try to uncover these leadership capabilities. And I'm sure most of us during the experience of working in hospital, in private sector, we acquire by experience some leadership capabilities. And definitely, we would like to uncover these leadership capabilities and streamline all these leadership capabilities to put it for the practice and for the patient care. And what is the future scope for health service today? We knew that every day the healthcare system is changing. And especially after COVID-19, the healthcare is an agile and it started to respond to change every day. And therefore, what is the current approach or traditional approach? For example, when we talk about the 21st century of healthcare system, and definitely this change from, or this paradigm shift from a traditional approach to more proactive approach will allow us to learn about leadership. What is the characteristic health system in the traditional approach or in the modern approach? It is no longer to provide the service by silo, but now we would like to work in interprofessional manner for patient care. Why to work in interprofessional manner? Because the patient expectation is changing a lot. If we take, for example, a patient with diabetes, definitely this patient needs food care, needs nursing, needs sociology, needs psychology, and needs dietitian, and of course, need internal medicine physician and clinical pharmacist. So this era, definitely we are working in a team, and this is one of the leadership capabilities which we would like to acquire during this presentation. And again, the care now is more value-based care. And the care is moving from traditional healthcare system, primary, secondary, and tertiary, to more virtual and community engagement. And therefore, this value-based care and this movement towards accountable care organization, this is definitely need some leadership capabilities. And the patient is our focus. And we have also to share a knowledge between us. And safety is our priority. And also the decision need to be on evidence, and also transparency and cooperation and other. All these attributes allow us to become a leader. No way not to learn the leadership skills, because if you would like to share knowledge, you have to work in interprofessional collaboration. If you would like to develop or to provide value-based care, you have to learn about the clinical leadership and the clinical governance. And also, if you would like to provide an evidence-based care, you would also like to know about research. This is definitely need leadership. And therefore, if you look for the different domains of curricula, like CAMED or NHS or any curriculum for medical education, you can find leadership is the core or is the heart of this competency framework. Not only that, and I'm sure some of you, and maybe most of you, they would like to have some professional certifications like CPHQ, CIC, PMB, risk management, CBBS. And when you look to all these certificates, you will find leadership competency is there. And this is me. We would like to learn more about this competency framework. And also, when we talk about the new paradigm or new area for the organization, we can see leadership here is the most important area, because without leadership, we cannot develop strategy, we cannot lead our workforce, and ultimately, we cannot achieve the result. Therefore, if you look also to the WHO framework of healthcare system, you will find the stewardship and you find the leadership is the top, because this is also a very important attribute for provision of healthcare. And this is actually from the Ministry of Health in Saudi Arabia. And this is, you can see the characteristic of a leader. And those of you who mentioned at the beginning, they would like to know what are the characteristic of the good leader. Here is the characteristic of the good leader. So the good leader is always encourage people, encourage the staff. The leader is always support his or her subordinate. The leader is a proficient, is a role model. The leader cannot ask the subordinate to come at 7 o'clock and he came, for example, or he comes at 9 or 10 o'clock. He's always honest, transparent, with open communication. The leader has a clear objective. He's a role model. He's inspiring people to work. If he is there, people they work. And if he is absent, still people that work, because leadership about influencing people to work regardless your physical availability. You always inspire them to reach the vision. Leader look always to the benefit to his staff. And leader, of course, will have a clear visionary. A leader has also a good communication skills with different type of communication. Also, the leader also look for the improvement. This may not be all characteristic of a leader, but when we look to each of these characteristics, definitely there is tools to think that. Excuse me, Firdaus.
Hello,
Yes,
hello.
yes.
We have many shouting voice. I cannot hear you well.
Yes. Please, we would like to request from those just mute their mic. Yeah, now it's okay. Let us proceed. This is some of the report of nursing and nursing leadership, so I can share the presentation later, so you need just to go about it. Now, I would like to share my personal experience with the nurses. I didn't study nurses, I study medicine, but I learn a lot from nurses. And let us see together about these stories, because it's inspiring me. In early 1992, I was a second year medical student at the University of Khartoum. And at that time, we went to Khartoum Teaching Hospital to learn from nurses. And what to learn from nurses? We learn the different skills, but not only the different skills of giving IV, it's also how to compassionate care for the patient. And this is, I'm still remembering not only these skills, I am still remembering when I visited a rural area in Sudan, where a nurse is not only a nurse, he is a care provider. I learned from him how to treat the patient and how to educate the patient. And I remember the case was diarrheal disease and how to educate the mother about diarrheal disease. And also, this is, I mentioned, in a rural area, not only treatment, but also professionalism. And therefore, professionalism you can call, not only be taught. Therefore, this is also a role model. And maybe strange enough, after maybe more than 20 years, I participated with some university here in the problem-based learning approach. And one of the things in the curriculum in the first year for the medical student is to go to the hospital and spend 1 month, as this is called care internship. And what is the objective of care internship? The medical student will follow the nurse on their daily task to learn about the care internship. This is also now it is a part of the problem-based approach in the medical education. And this is, I would like to share with you 3 case study to live and to love and to leave a legacy. And you can see me now. Now I get old. This is very young. And you can see this is nurses participating in the immunization of children. And you can find nurses everywhere. And if you look for the critical shortage globally and in every country, you can find nurses also. But not only, even the time to spend with the patient, definitely the nurses is the near to the patient. And therefore, we choose this topic about the nurse leadership because we believe if we have strong nursing leadership, this is definitely will contribute to the patient care. Not only that, this is definitely with other professions. And this also, I remember when I did my PhD study, also many years ago, don't ask me when. And also I learned from the nurses in the reproductive health. The nurses, as I mentioned, it's not only giving care, but also giving MCH services, especially in the rural area. And now, if you go to the literature, there is a clear evidence that sometime in some of African countries, they develop certain initiative like task shifting and started to train nurses how to do cesarean section. And this is definitely result in a great impact in reduction of maternal mortality. And this is the same story. And after I graduated and get my PhD, I assigned as an assistant professor in community medicine, University of Khartoum, and start to teach my student, medical student, about the importance of different healthcare providers, particularly the nurses, during the rural residency program. And I remember one of the students asked me, I didn't recognize the role of nursing, midwife, and health visitor unless when I see them, I talk to them. Because sometimes, for medical doctor when graduated, maybe he or she thinks that he is the only one who can provide care. But this is not true. We work in a team. We work in a complementary team. Therefore, the medical student need to be early learn about, for example, the different staff. And if we look, for example, to the curriculum of Harvard Medical School, you can see most of the students in the first year from different backgrounds, they learn together in the first year. Dentists, nurses, pharmacists. And why is that? This is definitely to teach the student and encourage them about the interprofessional collaboration at early stage of their life in medical education. And also, Not only that, if you look, this is a graduation maybe in one of the states in Sudan, graduation of nurses. And you can see just by inspection, you see the discipline and you see the uniform. And this is also can teach us a lot of things in healthcare. And this is also participated in the graduation of nurses. So why nursing leadership? The IOM report, Institute of Medicine report, as you're aware about it, is emphasize the importance of leadership in healthcare. And leadership is expected everywhere. And when we look to the healthcare now, it is not only provided in hospital, it can be in primary care setting, in community care setting, or even in a virtual care setting. This definitely need leadership capabilities. And many studies, there is great, a lot, yeah, there is a great and evidence we will see later about some of these studies. And this is some of the study, you can go towards it, talk about the leadership in accreditation and the role of nurses. And why nursing leadership? There is service change. I talk about this later. And public expectation definitely is increased. Integrated approach of services, technology issue, and demand of service. Let me just give some examples of this. As I mentioned, service change, this is definitely means that the expectation of the patient are increasing. And the public expectation also increasing. This is also a reason for why leadership matters. And nowadays, most of the healthcare is integrated approach of service. And definitely the changing of the digital health, the technology issue, this is definitely will be impact the leadership in nursing. And again, there is an increased demand of service. This is also will be reason for nursing leadership. And we have many challenges today. I don't want to go into details. This presentation, we can share it with the academy or the training institute. And what is the challenge? Why we need leadership? Because leadership is not only leading a team. Leadership is not only assigning tasks. Leadership is not only distributing tasks to different people. We need leadership, would like to implement the policies and system. And also, we would like to distribute the role and responsibilities. We would like to motivate our staff, even without incentive. We would like to accept the risk and the responsibility. And of course, there is different cultural background, and this is a multi-sectoral approach or multi-cultural approach. And as I mentioned, there is critical shortage. This critical shortage needs coordination, collaboration, shortage of supplies and equipment, definitely. And I like this frame, which I quoted from Management Science for Health. It talks about how a nurse or just general leadership start. Normally, we would begin with end in mind to have a clear vision. And then we have to identify the challenge and priority. And what I mentioned before, those are not a problem, it is a challenge. And this is one of the difference between a manager and a leader. The manager always looks to the problem, can hinder his or her work. But the leader, no. Always look to the problem to overcome this problem. Leader always take a risk. Some of the nurses, maybe they would like to live in a comfort zone, very calm. They don't want to take a risk. But if doing like this is definitely not leadership attributes. The leader is proactive. The leader scan the situation very well, make a robust situation analysis, identify the priority actions, and also have a measuring and clear result. And you can see this just excuse me, please. Okay. And if you look to this report, like WHO report, they have different report. You can see this report about.
Can you return to the third?
Farah, can you mute your voice, please, Farah? Okay, thank you. And I already talked about task shifting, and this is another area for human resource for health. I don't want to talk about in detail for that. And this is some of the study about the leadership role in the primary healthcare. So you can go later, but definitely the leadership improve the outcome. We will see later. Barriers for nurse leadership. This is also interesting study. What are the barriers? What are the obstacles? If we would like, if a nurse, I am working in a certain center, primary center or whatever it is, what are the barriers? So, yani, this study found that some nurses, they don't perceive the leadership skills as a decision making. Okay. And this is also lack of knowledge or lack of skills is also another barrier. Lack of long-term vision is another barrier. Lack of opportunities, lack of training, all these are barriers. And therefore, this presentation is aiming at just improving, at least, we know it is not a full training, but just the knowledge behind the leadership among nurses. Okay, let us move. Yeah, this is the first important step for how to become a leader. Now, we know about the importance of leadership in general. I would like to start from tomorrow to become a leader. That is good. That is excellent. But just stop to know yourself. If you don't analyze yourself and attributes, definitely you cannot lead others. Therefore, the first step to identify our strengths and our weaknesses. And there are different tools. One of the tools called MBTI is one example where it just analyzes our attribute and our behavior. And we will see this in a while. And I'm sure some of you, maybe most of you, heard about Johari window. What is Johari window? Johari mainly shows that we have different dimensions about our weaknesses and about strengths. And this dimension has been organized in 4 quadrants. The first quadrant is open. And what is open? Open means that this is what you know and others know about you. This is what things are clear, you cannot hide from others. The second point is the hidden. This is something private that others they don't know about it. And the third quadrant is the blind. This is very important. And this is what others know, but you don't know. Maybe you are negligent. Maybe you are not transparent. Maybe you are not communicating well with your staff. And you believe that you are communicating well. This is a blind area, which you need feedback. You would like to know in order to improve. And the last but not least, this is unknown area that is neither you know and nobody other know. And this area which you need a test like MBTI test to do like this. I give you another example from the clinical field. Maybe you don't know you are diabetic, and people, they don't know you are diabetic, but if you go and do screening, this will be obvious. This is the same for some of hidden attribute, and the MBTI is one of that. And this is just a revision. This is an open to know to self, others. This is a blind to not known to self, but known to other people, they know you. And this is the hidden, and this is the unknown. And therefore, Hind Khalid, would like to say something, Hind?
Yeah, Assalamu alaikum. Firstly, I want to ask about what's the difference between the hidden and unknown. For me, it's not clear.
Yeah, the hidden, that thing is you know about yourself, but nobody knows about that. Like the private thing, I know, for example, about my privacy, but the unknown, those things you don't know, and others also don't know. Is it clear? The hidden,
Yeah, it's clear. Yeah,
yeah,
it's clear.
thank you, thank you.
But I want an example for what is unknown.
Unknown,
can be what?
I give you an example. Do you know you are diabetic? No.
Yes.
It is unknown for you and unknown for others. But if you go and do screening, this is something, it will be obvious because you don't know it and others know it. And therefore, we will use the tools called MBTI. These tools, when you do analysis about yourself, it's just like screening yourself in the leadership attributes. Is it clear?
Yeah, it's clear. Thank you.
Thank you for you. And this a very interesting tools. I hope all of you today or tomorrow in the weekend try to test yourself about the MBTI. MBTI is the Myers-Briggs type indicator developed in early, I think, 1930s by Isabel Briggs and her mothers. Okay, and I don't want to go in detail about the name, but this is a psychologist based on psychologist theory. And the main aim of this MBTI is to detect the unknown attribute about yourself. Let us move and see what are these attributes and what are these tests look like. This indicator is one of the famous steps. This is the Myers and Hermaser. You can see this is the one they built on it. This is just for history. And the MBTI examine ourselves in 4 domains. What are they? The first domain is extroversion versus introversion. And this is very important. Please just focus for a moment. If we say, if you understand ourselves by using MBTI and instead others, definitely you can behave with them. Because understanding other attitudes of people, definitely this will shape our behavior with them. What is extroversion and introversion? The extrovert is the people who always open. And I give you a simple example. Sometimes if you have a new nurse in the department, some of the nurses from the first day started to talk to others, to socialize. This is extroverted. But some of the nurses are very calm, shy, trying to analyze the situation, to understand the culture. So this is difference domain. So each of them has special behavior that can impact the leadership. Another domain is sensing and intuition or intuitive. And this is also examine how we can take the information. Some people use the common sense for taking information. Other people know. They use the gut sense, the intuition to take the information. And this is also can impact leadership attributes, thinking and feeling. Some people using thinking when they take decision, other you feeling. Like for example, if I would like to take a decision among one of the nurses, I use, am I thinker or am I feeler? The difference between them. Last but not least, how you deal with the outer world. Are you judging, perceiving? And when we talk about the source of energy, where from we acquire our source of energy, the extroverted people, they always interact with people, they communicating, they learn best by sharing ideas and discussion. As other people are very quiet, prefer writing, private. So sometimes if you are a leader and you have a nurses, for example, and very quiet, you don't think this nursing is not well. So this is also need. So knowing yourself, yeah, hint, and knowing others, definitely this is will show how you communicate and how you lead and how you provide tasks. The second domain is taking information. Sensing people, they are working with the kernel situation, always use factual knowledge for their work. The intuitive people look always from the big picture. So which is best? Nothing is best. It's just about an attribute, it's just about situation, it's just about knowing other people to behave with them. Preference of making decision, thinker versus failure. And you can see the thinker analyze the situation and the feeling always support others. And we have many examples for that. We can mention it easily. And when you analyze these 4 domains, you can have different type of leadership style. Inspiring leadership style, socializing when, thinking, and you can see it different. And you look to this letter. What is this letter? This means that extroverted, intuitive, thinker, and judgment. And this very interesting. We can share the tool. The tool, very important when you start to assess yourself. Don't write the best thing. For example, one of the questions mentioned to you, when you start to take a decision, are you going to use your feeling or thinker? Or are you going to use the relationship with the subordinate? So you have to answer honestly about current situation, not the ideal situation. And then you can see your, for example, attribute. And you can see here also the different, some you can look here, teacher, counselor, it differ. And this is why leadership is a very complex topic. Yani leadership is a very complex topic, but it is very important topic. And therefore, one of the characteristics of a leader, a nurse leader, he or she should analyze the subordinate, and also she has to treat anybody individually based on certain attributes. So what is leadership? Different definition of leadership. Let us think again and maybe have 2 minutes for discussion. What is leadership? Any idea? Any idea, Shabab? Any idea? When we say leadership, what is that? What's the word coming in your mind, please? Yes. Remember
Okay.
our, yes, please.
Yeah, hello.
Yeah.
My idea regarding the leadership, maybe it's about leading others towards something. You
Okay.
guide them, following, for example, a certain way to reach some point.
Yeah. Can you just introduce yourself where you are working, just to know the participant?
Yeah, okay. I'm Ahmed Osman Ahmed. I'm Assistant Chief Nurse at Fidel Hospital, Khartoum, Sudan.
Okay. Welcome. So talking about.
I didn't hear you actually.
Yeah. Thank you so much. So you mentioned the leadership is leading people towards.
Hello.
Yeah. My voice is clear now. Ahmed Osman, maybe you have some problem in network. Sheila, raise your hand. Sheila, please. Yes.
Yes, sir. Good evening.
Yeah, can you introduce yourself and where you are working?
I'm working in Aflaj General Hospital Dialysis Unit as a charge nurse.
Okay, welcome.
My opinion as for this one, leadership has the capacity to coordinate our staff, teach them new things, lift them to get a maximum achievement with a good quality, good care.
Excellent. Thank you, Sheila.
Thank you, sir. Welcome.
Who else, please? Yes, Imtinan Faisal.
Yes, alaikum.
Alaikum salam.
I'm Imtinan Faisal.
Yeah.
Imtinan Faisal, assistant nurse in dental clinic in Saudi Arabia.
Yeah.
When we are talking about leadership, it just means just to guide some of people. No, it is just a group of people. They work together to achieve the main goal or main objective. To organize the work, they work together, يعني not for just one person, should all be cooperative.
Excellent, thank you. Anyone would like to add something?
I have.
Yeah, welcome. welcome. Please.
Hello, salam.
Alaikum salam, welcome.
Assalamu alaikum.
Alaikum salam, welcome.
I am Dr. Muhammad Jabradar, head nurse. I am in Sudan, from Sudan,
Welcome.
as the Dean Faculty of Nursing Science, International University of Africa. So it is a very interesting topic about the leadership that we lack it in nursing very well. So we lack most of the nurses. They know that the leadership just is to guide the staff to achieve the goal of organization. It does not look like this.
Yeah.
It is to guide even the patients. Patients need to be guided by the nurses or to be as a leader or the model for their continue their cares.
Excellent.
So most of nurses, they are absent of model of leadership, which is with to go loose without any vision. I reflect that in their care because they have an absence of the model that considered as the agent of change.
Excellent.
In the nursing.
Thank you so much.
Also, I need to give you a very important issue.
Okay.
What about the team culture? It also lead to misunderstanding of leadership. So I think it is very important to know about the leadership, and I'm very proud to be a doctor to talk about the leadership in nursing, because we are working professional and relation with other colleagues in medical field. Thank you.
Thank you so much. This is very interesting and inspiring, and we will see later in the discussion how is the team and the team approach will influence leadership, and of course the leadership is definitely about making teams. Yes, welcome Hassan Ali Sharif.
Leadership is an important function of management.
Can you introduce yourself, please? Where are you working?
Leadership is an important function of management.
Okay.
It is the key to effective managerial performance. Organizational success depends on the quality of leadership.
Excellent. Excellent. Where are you working, Sharif?
I am from Mogadishu, Somalia.
Oh, welcome. So, what you mentioned all together, just to make it summary. Hind, would like to say something, Hind?
Yeah, Assalamu alaikum. My name is Hind Khalid. I'm lecturer of University of Khartoum Nursing College.
Sharif, you would like to say something because Hind would like to continue. Sharif.
Okay, and leadership influences the behavioral of others.
Yeah, excellent. Influence, thank you.
And the leadership is guiding and influencing people to achieve goals.
Thank you, Sharif. Thank you.
Thank you.
Thank you so much. Hind, carry on.
Yeah, my name is Hind Khalid. I'm a lecturer of Nursing College, University of Khartoum. I want to just define a simple definition. Leadership is an art of motivating a group of people to act toward achieving a common goal.
Excellent.
Thank you. Thank you.
Thank you so much. And I think most of you now, definitely just to close the loop or to summarize what it's mentioned from all together. Thank you so much. Leadership, of course, about influencing people. You influencing people, you are leading by a role model, you motivate people, you create a team. And sometimes, especially in healthcare area or healthcare system, we need what is called an agile team. And even the agile team, the one who, there is no team leader, there is what is called Scrum Master. And Scrum Master, which attribute of leadership can acquire, is called a servant leader who serve everybody. And definitely I agree with you, Idris. The leadership is not only leading the nurses to achieve the patient experience and better patient experience. And therefore, very important for a nurses when leading a group of people in a ward, in a health center, in a whatever it is, to have the final vision and the final mission which related to the patient. And this is also very important. Let us look to the different leadership concept from the literature. So leader, you enabling others to face challenge. A leader allow people to face challenge and solve challenge. Leadership in different study, we will see later, they show that leadership can impact the patient outcome. Therefore, you cannot find one definition for leadership, but a leader influencing people, motivating people, guiding people in a team towards certain outcome and certain objectives. And when we talk about management, because sometimes people, they are talking about what is management and what is leadership. And I remember one of the expectation of one of your colleagues here, they mentioned that assigning task is a leadership. Assigning task is not a leadership attribute. Assigning task is a management attributes. Therefore, we need to learn management first in order to be a leader. So management and leadership will be interrelated. I cannot say planning is not important. I cannot say distributing tasks is not important. But you need to distribute the task with a clear vision and with a clear motivation. And this is the essence of a leadership. And many study, let us see the different study here. This is different study. We can maybe see it later. This is another study talk about the indicator of leadership. Okay, and this is a different indicators of leadership. Okay, if you would like, this is very important, especially for those working in medical education. So what are the leadership indicators that indicate somebody acquired leadership? Let us take some example. When you talk about the capacity building, the indicator definitely will relate to education. And therefore, one attribute of a leader is always keeping abreast with the current advance and the guidelines. So the leader is always seeking for knowledge, always seeking for training, always seeking of evidence. Why? Because the leader will be a subject matter expert where the subordinate refer to him and her. And this is just one example. And there is a lot of evidence talk about the, this study shows the relationship between leadership and nursing. It is a systematic review, and there is clear evidence between the leadership style and patient satisfaction. And also the study shows that the proper leadership style not only improves the patient satisfaction, it also reduces the adverse event. This is a framework for nursing. And this is also, to me, very important. And we have also to look at it. So the framework of nursing starts with structure, process, and outcome. And if the nurses acquire the proper leadership style through training, definitely they will implement certain activity. And you already mentioned about that. Creating a work environment, motivating people, building a team, facilitating a care process, and promoting participation. This definitely, from this systematic review, found that proper leadership skills can improve patient outcome. This is another study, or maybe the same study. Don't want to go that. And this some of the leadership competency. So, maybe we cannot complete the presentation today. And my suggestion, maybe it is up to you. I can complete. Don't have a problem. But I don't want from you to have many information to confuse you. It is almost 10 o'clock now here. But let me conclude with this slide, and I promise you all, we will try to repeat this session and complete session. Because actually this session is a part of a training program. It is 2 days training program, some workshop or some activity, and very difficult to cover it whole here together. And let us go to the certain competency, talk about collaboration, balance. This is maybe easier. This is another study show what are the competency. And what is the competency? Competency is the ability to do work. If you are competent, it means that you have the ability to do work. So what are the competencies of a leader? He has a visionary thinking. Always begins in mind. And we will see in the next presentation about interesting book in leadership by Stephen Covey, 7 Habits of Highly Effective People. We will try to study these habits and why we can implement it and how we can implement it and the know-how we can implement it in our situation. Team, team, team. But the team should have what is called a team charter. And the team charter, it means clear role and responsibility. And the team is working together in a complementary manner. The leader is passionate, motivate, and influence others. Leader also delegate, but it is not haphazard delegation, it is appropriate delegation. And the leader, last but not least, should act with integrity. And this is from interesting paper about what leadership style should senior nurse develop. This also another study talks about what are the competencies of leadership. Technical leader need technical skills and non-technical skills. What are the importance of technical skills? I cannot be a leader, for example, and I don't know how to give proper NG tube. It is impossible to be a leader in nurses, and I'm not competent in my core competencies, giving injection or caring of the patient or following the patient. But what are the non-technical skills? The non-technical skills such as leadership, thinking system, thinking visionary, quality, emotional intelligence, all these non-technical skills need to be possessed. And then definitely non-technical skills like teamwork, communication, situation and awareness, and also there is another important area about what when we talk about the different leadership style, there is no single leadership style that fit all the situation. So it is almost just, it is, yani, we can say situational leadership. Engaging leadership. So I guess I suggest to stop here because we have many things to do later. Any questions so far? I promise you, inshallah, I will complete because we will have the different leadership style. We will present some study. We will talk about the difference between leadership and management. We provide evidence how leadership impacts the patient care. We will start also to discuss the different level of leadership. And also this is a very important framework. Maybe next time we talk about the manager who lead and what are the attributes for the management. Dr. Atfa, are you there? Just to say something before we have the question. Dr. Atfa. So just to summarize what we have so far, we talk about, yeah, better next time. Yes, okay. لأنه يعني أنا شايف الناس الآن واحد ماشي نعسان وداري ينوم وعنده أغراض and so on. So what we discussed so far, we just have high-level information about what is leadership, why leadership is important, the leadership and health systems, leadership and governance, some of the framework of a leadership. Any questions so far before we conclude? Any suggestions so far? Any question? So any question?
Hello.
Yes, yes, please.
Hello.
Yes, Muhammad. Yes, welcome.
Muhammad Jibril.
Yes.
I'm sorry. So the voice is interrupted in Sudan because you are a very weak internet.
No problem. The
Do you hear me?
Presentation is recording and we can share it later through the academy or the training center. Yes?
Okay. Oh, okay. Thank you.
Okay, thank you. Thank you. We know the killing of the internet.
Hello, Chore.
Yeah, no problem.
Hello.
Hello, Sharif. Hello.
Chore, and what is the difference between management and relationship, leadership?
Yeah, this is we will discuss next time. There are many differences between leadership and management. And because you asked the question, I can give you 3 differences now. Leader always doing the right thing, while manager doing thing right. Leader focus on people, manager focus on task. Leader always has a visionary thinking, the management do a daily task. However, there is certain differences, maybe reach 15 or 20 differences. We will discuss it next time. And thanks again for your question.
Thank you. Chore, and can I ask you another question?
Yeah, welcome.
What are the advantage and disadvantage of leadership?
Yeah, leadership, definitely, when it being implemented in proper way, it has advantages, but no disadvantages. If leadership does not implement it in a proper way, definitely it has disadvantages. So you cannot say advantages and disadvantages. So leader is always benefit the team, benefit the patient care. But if it's somebody who become a leader without like leadership imposition, we will say We will see next time the different level of leadership. The least level of leadership is called position, and this has many disadvantages. We will see next time also. Be with us, Sharif, next time.
Thank you, sir. Thank you.
Hello.
Yeah, تفضل يا محمد جبر الدار.
I need to add something to the floor that as the audience of this presentation.
Welcome.
In nursing, the leadership is needed in every nursing activity. Either if you are a nurse or a staff nurse, and even if you are a head nurse, and also if you are a supervisor, or you are a nurse director, you need all the time to guide the others towards accomplish common goals. It's very important to add this. So the leaders usually influence others to attain and maintain the high standard of performance. This is very more important one. It is of it. So it is very important to distinguish between the leadership and the management. So leaderships usually they base on influence and not on authority like the management. So leadership, it is not an informed designation. It not need a key position. It's an active position. So every leader can act. Every nurse can act as a leader, and they are part of the every nursing role, independent on management. This is very important issue here. I need to add this. Thank you very much, Mahir.
Thank you, Muhammad Jabradar. This is a very interesting. And inshallah, next time, what you say, for example, we would like to put it in a bracket.
Hello?
Yeah. Hello? Yes, thank you so much. We will see next time.
Dr. Hatim, if I can add something. Ahmed Osman.
Ahmed Osman, again.
Okay, I just wanted to add maybe in the next time, if you can shed a light on the habits of highly effective people, maybe as an attribute, or regarding the attributes of the nursing leaders, or the nursing the nursing leaders. So if you can do it, to integrate those 7 habits of Stephen Covey, and I heard that they were being 8 habits of highly effective people. I think they are very very valuable, or so valuable. If you can just talk about them next time, inshallah.
Yeah, it is in the presentation. I can show you maybe later. Yeah, we have, this is the presentation. We talk about different studies. We talk about the framework here, manage yourself. And then where is the different habits, manage resources. So we have a lot of things to do next time, inshallah. Setting direction, evidence.
Inshallah, thank you.
So I agree with you. These habits are 8, because I think his son had the 8th one. Like this is the difference between management or leadership. Don't worry, Sharif, it is there. Talk about it.
Sorry.
Okay. Sheila, I would like to say something, Sheila.
Yes, sir. It was very excellent discussion. Really, first time I am attending such a program regarding leadership. Really, I am so happy to with you. I will continue with you next coming days. Thank you very much, sir.
Yes, thank you so much.
Yes.
Thank you, Sheila, and you are highly welcome. We talk about different leadership style next time.
Yes, sir.
This is the level of leadership. We will take some
Yes.
scenario.
Yes.
Leadership. I just would like to go for Ahmed Osman.
Okay, sir. Thank you, sir. Thank you very much.
Yeah, no problem. And don't worry, we have some Arabic, but we will translate for you.
Okay.
Okay, okay. This is the different level of leadership next time.
Okay.
This is the 7 habits.
Yeah, 7 habits. Yes, sir.
So it is 8 habits. اطمأن قلبك يا أحمد عثمان. Yes. Okay.
Yeah. Okay. Inshallah, next time we may we will be so happy to
لا لا إن شاء الله.
join you, inshallah, for this discussion.
Inshallah.
So thank you so much.
Excuse me, Doc.
So thank you so much, and definitely see you next time. We will arrange it in a convenient. Most probably.
Excuse me, Doc.
Yeah. Any question?
Yeah, I wanted to add something. Really, I hope if all staff nurse they attend in this lecture, because really we have always more problem in contact with leadership and the other nurse. Really, and I hope all nurse here attending here to share. To share this lecture and invite the other. And just I wanted to ask when it will be the next lecture so we can be attend.
Inshallah. I think the next lecture will be arranged with Dr. Atfa and the training center. Inshallah, we will arrange it. Most probably will be on the weekend because we are very busy during the week. So we'll try to do it in the weekend, inshallah, and we'll try to deliver it to all of you.
Inshallah.
Okay, thank you so much. وتصبحون على خير ونلتقي إن شاء الله.
Dottore.
Yes, 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 yes.
Hello, Dottore, and tell me the time of next period.
Yeah, I think they will advertise it through the WhatsApp, I'm sure. If you are in a group, you will, because I cannot determine the time now.
Thank you, thank you.
Yeah, but it will be soon, inshallah.
Thank you.
Okay, so next time, inshallah, we will meet, and thank you so much, and تصبحون على خير, inshallah. السلام عليكم ورحمة الله.
Thank you. Thank you very much.
Thank
Lots
you.
of,
Thank you, Dr. Hatim.
lots of thanks.
Thank you, doctor. See you.
Expecting more next
See you
time.
next
Thanks a
Friday.
lot.
See you next Friday.
Thank you, doctor. Thank you, everyone.
Bahat